This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Miol G is a combination medication used for managing nerve pain. It contains gabapentin and methylcobalamin, providing effective relief. Indications and uses. This medication is indicated for the management of nerve pain, which can arise from various conditions, including diabetes, injury, or nerve damage. It helps alleviate discomfort and improves patient quality of life by targeting pain at the source. Additionally, it supports nerve health by repairing damaged cells and enhancing the protective myelin sheath around nerve fibers. How it works. Miol G works by combining the effects of gabapentin, which reduces pain signals between damaged nerves in the brain, and methylcobalamin, which repairs and rejuvenates nerve cells. Directions for use. Take this medication as prescribed by your healthcare professional. It can be swallowed whole with water, and it is important not to crush or chew the tablets. Patients may take it with or without food, depending on their preference. The exact dosage and duration will be determined by the doctor based on individual health conditions, age, and body weight. It is crucial not to stop taking this medication abruptly without consulting your physician. Possible side effects. Possible side effects may include dizziness, sleepiness, nausea, and emotional changes. It is important to monitor these effects and consult a doctor if they become bothersome. Precautions and warnings. Consult your doctor before taking this medication, especially if you have any pre-existing conditions such as kidney or liver disease, or if you are pregnant or breastfeeding. Also, be cautious about potential interactions with other medications and avoid alcohol consumption while on treatment. FAQs. 1. How long will it take for Miol G to start acting? It may start to show effects from day 2 of administration, with initial pain relief after 2 to 4 weeks. 2. Can it manage diabetic neuropathy? Yes, it is effective for nerve pain caused by diabetes. 3. What happens if I stop taking it? Abrupt cessation may lead to withdrawal symptoms. 4. Is it safe? Safety varies. Your doctor will monitor your condition closely. 5. Can it cause weight gain? Yes, it may increase appetite. Managing weight through diet and exercise is recommended. Thank you for watching. If you have any questions or suggestions, please feel free to leave them in the comments below.